Good evening, everyone. Hello. Welcome to our Facebook Live on Delegation and Prioritization again. So it's Thursday, and we're doing this a little bit late tonight. Our apologies, but we have prepared some good questions for you, everybody. So we were flashing all of your comments before the start of this session for tonight. Okay, so thank you very much, everybody, for being here. Before anything else, I would like to introduce myself. My name is Mr. Alan Matus, and I am a nurse educator. I have been teaching for almost 25 years, teaching students NCLEX and also helping nurses pass their NCLEX examination. I'm currently a nursing faculty, so I'm practicing. Practicing nursing faculty, and also I'm the president and the founder of Matus Nursing Review and Matus Nursing Review online NCLEX Academy. All right, and then also I'm a an author, so I have a book that I published in Amazon and also available in other bookstores as well. So the name of the book is Simple, Fast, and Easy NCLEX Review. So thank you very much, everybody, for being here tonight. I will be having some questions, okay? And again, I'm really excited to discuss these questions with you, everybody. So hopefully, you'll be able to get the right answers to the questions tonight, everyone. So a little bit of shout out. Okay, so Alan here. Thank you very much for being here tonight. So good evening and good evening, everyone. And thank you also for letting other people know about this session as usual. Okay, so without further ado, let's go directly into our agenda for tonight. All right, and don't forget, October 1 is the first day of the implementation of some changes in your NCLEX. Okay, so we have now 75 questions as a minimum, and the maximum will be 145 questions. And we have some students sending us emails asking about the details of these changes. Some students were asking, there's 15 pre-test or research questions in this examination. Well, these 15 questions are not scored, and at the same time, they're being mixed in the examination. And you will not find out or know if these questions are research or pretest items or experimental questions also. Okay, so by the time you end your examination, you should have at least 15 pretest items, all right? And they are not scored. So let's proceed to our first topic for tonight. Okay, so we have Christian Cruz. Good evening also. Okay, so we have this motivational photo of the week. So this was sent to us by our student, Menchi from Singapore. And she's studying with a workbook that we have. So that looks really, really very nice, especially with the coffee. It looks like a cappuccino, I guess, or something. But that's really a very nice picture showing to us that she is really studying very hard. And so far, hopefully, the workbook and the online academy, watching the videos all over again, is helping you master your core content. Always remember that in our review program, the ultimate secret to passing the NCLEX, if there is one, the first one is always knowing your core content. And that is the focus of our program. In Matus Nursing Review, we help students learn content or master content in a simple, fast, and easy approach. Okay? All right. So another one, okay? So another one will be, we just want to show you a little bit of testimonial from one of our recent passers. So Ginger recently passed her NCLEX PN examination, and she said in her recommendation last September 12, so she said the 12 weeks program and the workbook is a perfect combination. All explanations are very direct to the point. Facebook Live helped me to understand the questions and choosing the right answer. And every Tuesday webinar class before, I was scared, but when I attended the class, I felt comfortable. You can ask questions. Highly recommended, and the price is reasonable. Thank you, Sir Alan, for your big heart. To all students that have worries NCLEX like me, please enroll at Matus Academy. So thank you very much, Ginger, and congratulations in passing your NCLEX examination. Okay, and really thank you very much, everyone, for your testimonials. If you do pass your NCLEX and these sessions help you out, guys, let us know so that we would be able to congratulate you. Okay. All right. And for tonight, I have very good news for everybody. We will have the free 90-day online access NCLEX review contest again. So for tonight, whoever joins tonight will be part of the contest, okay? So, or the raffle. So next week, we will announce the winner. And also another surprise for tonight, we actually selected a winner for tonight. So whoever attended last week, okay, actually we decided to choose a winner. So we're going to um, tell you or announce the winner at the end of this session. So always attend this session, everyone, so that you will know if you won the 90-day online access NCLEX review. Okay, so all right, so let's congratulate Ginger for passing her NCLEX examination. Okay, all right, and thank you very much also for those people who sent us their photos while they are studying with the workbook or the online academy. We still do have other photos to share with you next week. So that really inspires and that really motivates your classmates to study when you're doing it at home. So thank you very much, and the feedback also. Thank you for liking the videos while watching them. Okay, so thank you. All right. So we'll announce the winner at the end of the tonight. So you make sure that you have to stay over. Okay. So without further ado, okay. So let's start with the first question for tonight, everyone. Can we have a big shout out like yes? Okay. Are you ready for our first prioritization question for tonight, everyone? Okay. So say yes, a big yes, everybody. So we will have your first question now, and I want to make sure that I present you the slides correctly. Okay. All right, so let's proceed. And if you do have feedback about the academy, let us know. I'll give a shout out here if you like the academy. Okay. All right. So Matus tribes, or can you please suggest, what will be the name of our community, everyone? I'm still really thinking how we are going to call our community. Matus nurses, Matus tribe. Can you think of a name? And is it Matuskers or Matusians or whatever? So can you please think of something? How do you think should we call our community, everyone? Matus community, Matus tribe, Matus nurses. Okay, so let me know. Put that in the comment section, or send me an email, and then we will appreciate your comments, everyone. Okay, all right. So let's proceed. The first question for tonight is going to be prioritization, everybody. And then, as usual in the NCLEX, you will have four patients. Okay, four patients or clients. So Joe Baldsky said that Matus tribe. Okay, Matus tribe. So let's see. We call it Matus tribe for now. So let's see. So welcome, Matus tribes. Okay, our students or community here in the Facebook Live, Matus tribes. All right. So Matus team nurses. Okay, so we have another suggestion. Matus team nurses here. Okay, or Matus nurses or Matus fans, or think of something, everybody. Okay. Matus USRNs. Okay, but then remember we also have LPNs, so that's why we will say Matus. So put some suggestions there, and I will read them later on, everybody. So let's have the first question for tonight, everyone. Okay. All right. Okay. So this is prioritization delegation, everyone, or this is prioritization questions. So the first question is: the nurse is caring for 4 clients in the medical surgical nursing unit. During assessment, which client requires the most immediate intervention? A, the 25-year-old client whose gastrostomy feeding tube has been dislodged. B, I like this, Matus achievers. Okay, that's good. Okay, so letter B, the 54-year-old client who had left hip arthroplasty and is complaining of pain. All right, so somebody suggested Matus babies. All right. C, the 34-year-old client admitted for chest injury who is coughing and has tracheal deviation. Letter D, the 44-year-old client with heart failure who has increasing jugular vein distension. Can you please indicate also the rationale for the answer that you have chosen, everyone? Why you have chosen a particular, a choice, and also what do you think is the condition or the complication in that condition that you have chosen, all right, or in that choice that you have chosen. So A, B, C, and D. Is it someone with tube feeding that has been dislodged? Letter B, 54-year-old client who had left hip arthroplasty, complaining of severe pain maybe. Letter C, someone who has chest injury, who is coughing and has tracheal deviation. Or D, the 44-year-old client with heart failure who has increasing jugular vein distension. Okay, all right. So you may have the correct answer, but let's see if you have the if you have the if you have any idea of what's going on with those patients. All right. So most of you answered letter C. I can see that, and letter C says airway is a priority. Okay. So let's find out with the answer. Are you ready, everyone? You might be actually wrong. So let's find out. Okay. All right. Now I have a question. What does a tracheal deviation indicate? Okay. It's easy to answer letter C, but then you have to justify why. What do you think is going on with letter C? What emergency or life-threatening complication is that? All right, so let's proceed. The answer to this question is going to be letter what? That is going to be letter C, everybody. Very good. So you got the right answer, everyone. But then the most important thing is to find out the reason why letter C is the answer, right? So it's not enough to say that, oh, it's airway, but what's going on with letter C? Okay, now letter C, someone said pneumothorax, and that is correct, pneumothorax, especially when you have tracheal deviation and coughing, and this is a chest injury patient. A chest injury patient may have accumulation of air in the pleural cavity, especially if it's an open chest injury. And an open chest injury can lead to pneumothorax as well as mediastinal shifting. So everybody write that down. You know, mediastinal shifting, Google that tonight. So what is mediastinal shifting? That would be when the contents of your thoracic cavity shifts towards the unaffected side because there is too much pressure. Okay, pressure on one side, and tracheal deviation is the sign of mediastinal shift. A mediastinal shift is an emergency because it affects the patient's breathing. It is a sign of emergency. Okay, it affects the patient's breathing. It affects the cardiac output. It compresses the heart, so it can cause the patient to develop obstructive shock. So it's very important to address this letter C first. Okay, but then before we move forward as well, you have to remember that in the situations, you notice A is also a priority, right? A is also a priority. Remember, when the gastrostomy feeding tube has been dislodged, you need to act right away. You need to follow your protocol. What are you going to do? If we don't do anything to letter A, what can happen is that the gastrostomy site or opening may close. Okay, may close. Okay, so that's why letter A is a priority as well, because you need to call the physician or the provider, or you follow your protocol how to maintain the opening of that site, right? Now, letter B, arthroplasty, complaining of pain. Always remember that in your prioritization is always airway, breathing, and circulation. Then you have safety, risk for infection, and then pain. Pain could be a priority, but it's not really the first few. Okay, so pain could be after airway, breathing, circulation, safety, risk for infection, and then you can have pain. All right. Now, letter D, that's actually a serious situation, everyone. If letter C is not present, D is a priority too. Why? Because D indicates what? Heart failure. The key word is increasing jugular vein distension. The word increasing means that the heart is failing big time. Am I right? So the heart is failing big time on letter D. So if letter C is not there, you will answer also letter D, right? Because letter D means acute failure, okay? Worsening heart failure. You have increasing jugular vein distension. So you see, in this question, when you are prioritizing, you can have more than one patients who are unstable, right? Or priorities, but you always have to choose the most unstable. A is unstable patient, it's an emergency. Letter D is an unstable patient, it's an emergency. But what stands out first is your airway, and that's why chest injury comes first, especially with coughing, which is a sign of mediastinal shifting or pneumothorax, and then you also have your tracheal deviation. So very good, everybody. Okay, so study your emergencies, everyone. Okay, so let's go to the next question, everybody. Thank you for your good answers there, everyone. So you're really learning. Okay, airway, but always remember, if airway was not there, then you choose another option, right? So let's have your next question, everyone. So some people said Matus nurses. Okay, Timitupi said Matus nurses. Okay, Benedicta said Matus achievers. So go Team Matus. So what do you think is going to be our name for this group, everyone? Okay, for our community. Matus Achievers, Matus Tribe. Okay, so we'll find out, everybody. Matus Fanatics, Matus Natics. Okay, but anyway, so we will now have our next one. Okay, so this is another prioritization wherein you have 4 patients. So an emergency room nurse is preparing to receive 4 clients after a motor vehicle accident. Which client requires priority intervention? So this is an emergency room nurse. It may really apply to a registered nurse, maybe because the RN, but then if you are the an LPN in your exam, always remember that concepts are transferable in any situation. So for example, just use your critical thinking on this one. So which patient comes first? Is it letter A? All right, the 35-year-old client with second-degree burns on the right arm. B, the 56-year-old client with paradoxical breathing due to rib fractures. C, the 65-year-old client with large bruises and lacerations on the abdomen. Or D, the 25-year-old client with a piece of glass penetrated into the eye. Okay, so an emergency room nurse is preparing to receive 4 clients after a motor vehicle accident. Which client requires priority intervention? A, the 35-year-old client with second-degree burns on the right arm. B, the 56-year-old client with paradoxical breathing due to rib fractures. C, the 65-year-old client with large bruises and lacerations on the abdomen. Or D, the 25-year-old client with a piece of glass penetrated into the eye. So you have to put your rationale. Why did you choose a particular answer? And always use the process of elimination as well. So use the process of elimination. Who do you think? Again, always use your principle: airway, breathing, circulation, safety, risk for infection, neurostatus. The level of consciousness as well is a priority. That's an indication as well if your patient is serious. And then you have pain issues as well. Okay, so what do you think is a priority in this question? So most of you answered. Without further ado, the answer to this question will be, all right, so most of you chose letter B. Okay, and let's find out if that's really the answer, everyone. Okay, all right, so the answer to the question, everybody, is going to be very good, everybody. That will be letter B. So good job, everyone. So most of you answered letter B, but then again, the question is, why did we choose letter B as the answer to this question? Now, the reason is because letter B, paradoxical breathing, okay, characterized by asymmetrical chest expansion or unequal chest expansion. You call that your flail chest, right? If you can remember, flail chest, FLAIL, okay? It's a sign of respiratory distress in patients having rib fractures. So some of the ribs are free floating. So when that situation happens wherein the chest movement is not equal, then that's a priority because that affects the breathing of your patient. Am I right? So your patient needs immediate intervention because B is a breathing problem. Okay, airway or breathing problem, letter B. So that comes first, especially the word paradoxical breathing, everybody. Okay, now A, second degree burns. Okay, letter C, large bruises and lacerations. Okay, now some of you answered letter D. If B is not there, then D comes first. Okay, because D, your goal there immediately is to stabilize the foreign object. Okay, making sure that we prevent further eye injury. So letter D is a priority because you have a piece of glass penetrating into the eye, and that is a safety issue. Okay. Now for letter A, you have second degree burns on the arm, on the right arm. There's not so much indication of unstable there with letter A. Although burns could be serious, but we don't have enough information to say it's really an emergency, right? Letter C, large bruises and lacerations of the abdomen. We don't really have a lot of information or additional information that it's really very serious. Okay. Although when you have large bruises and lacerations of the abdomen, then it could also tell us underlying problems as well. Okay, after a motor vehicle accident. But again, what comes first here is going to be letter B, everybody. Okay, so very good, everybody. So letter B is the answer for that. Now let's go to your delegation questions, everyone. Okay, so tonight, delegation questions. All right. So do we have international students in this class? Earlier, we showed students from Kingdom of Saudi Arabia. We have students from other countries. Okay, so let me know if you're from other countries or from different states. All right, so let's go to the next question. This will be your delegation question, everyone. The registered nurse is assigning clients for the shift. Which client would the nurse most appropriately assign to the unlicensed assisted personnel or UAP? Select all that apply. A, the client with colon cancer who requires colostomy irrigations. B, the client who requires vital signs measurement before a colonoscopy. C, the client with dysphagia who requires assistance with feeding. Letter D, the client who requires urine collection for 24 hours. Or letter E, the client with stage 4 pressure injury or ulcer who needs wound irrigation. Okay, so the registered nurse is assigning clients for the shift. Which client would the nurse most appropriately assign to the unlicensed assisted personnel or UAP? Select all that apply. A, the client with colon cancer who requires colostomy irrigations. B, the client who requires vital signs measurement before colonoscopy. C, the client with dysphagia who requires assistance with feeding. D, the client who requires urine collection for 24 hours. Or D or E, the client with stage 4 pressure injury who needs wound irrigation. Okay, so most of you got the correct answer probably. Let's see. All right, so hopefully these are the kinds of questions that you have in the NCLEX, and then most of you get the correct answer, right? So let's see if there's anyone else who have a different answer, because most of you answered letter B or D. Okay, so let's go to the answer, everyone. Okay, so the answer to this question is going to be letter B or D, everybody. So thank you guys. Good. So your UAP can perform, okay, can perform vital signs measurement, definitely, and also to collect urine for 24 hours or urine collection. As long as it's not a complex urine collection, then the UAP can perform letter B and then your letter D. Now, colostomy irrigation is a complex task, especially for a patient who has a colostomy. So licensed nurses are supposed to be the ones doing your letter A. All right. For letter C, remember, letter C, your UAP can also assist clients during feeding. However, the word dysphagia, you know, that is an unstable patient, someone with dysphagia. Okay. Letter E, the client with stage 4 pressure injury who needs wound irrigation. Wound irrigation also is a complex task. It could be done only by the LPN or by the RN only. All right. Okay, so thank you very much, everybody. Very good. Okay, so let's have the last question for tonight, everyone. Okay, so the last question for tonight is a different type of question. We haven't had these kinds of questions before, but I want to find out if you know the concept about this. All right, assigning clients to staff members. A client with shingles or herpes zoster is admitted to the medical surgical unit. So which staff member should not be assigned to care for this client? A, the nurse who never had measles. B, the nurse who's a negative varicella titer. C, the nurse who never had rubella. Or D, the nurse who recently received a chickenpox vaccine. Okay, a client with shingles or herpes zoster is admitted to the medical surgical nursing unit. Which staff member should not be assigned to care for this client? A. The nurse who never had measles. B. The nurse who was a negative varicella titer. C. The nurse who never had rubella. Or D. The nurse who recently received a chickenpox vaccine. Okay, so you need to know what is herpes zoster, everybody. You need to know what is shingles. You have to go back to your content. All right, you really have to know what is shingles or what is herpes zoster, everybody. Okay, so some of you answered letter A, some of you answered letter B. Okay, some of you answered letter C. Okay, some of you answered letter A. And I really discussed this concept in the academy. I really discussed this in the online academy. I discussed with the students what is herpes zoster all about, or what is shingles. Okay, so I really discussed this with the students. All right, so we have different answers for this group. Okay, so who should not be assigned to someone who has shingles or herpes zoster, everyone? So again, core content. Core content. So these are things that we discuss in the academy. Okay, these are things that we discuss in the academy, everyone. All right, so let's have the answer to this question, everyone. I will tell you, everybody, core content. Okay, core content. So my first question, everybody, is this. What is herpes zoster or shingles first? What is that condition? So if we go back to my online academy, I explained that this is a reactivation of what condition? A reactivation of what? Okay, so our final answer for this question, everyone, the answer to this question is going to be, okay, content. Very important, everyone, content. The answer is going to be letter B, everyone. Okay, so shingles, the nurse who has a negative varicella titer. Negative varicella titer. So always remember that your shingles, everyone, or herpes zoster is a reactivation of chicken pox. And the other name for chicken pox is your varicella. So if we do a blood test on a person and the person does not have the antibody or has negative varicella, then that person has no protection. So no immunity for letter B, and that is varicella or chicken pox. Now, A, the nurse who never had measles. Measles has nothing to do with herpes zoster, everyone. Herpes zoster is if you never had chicken pox, and you're exposed to herpes zoster, then that is not safe. The nurse who never had rubella. Rubella, everyone, is German measles. Letter D, the nurse who received a chicken pox vaccine, then definitely that could be a nurse that you can assign actually your letter D because the nurse received the vaccine, right? But at the end of the day, the most important thing is to always find out if the nurse has any immunity. And we call that titer. Titer means immunity, okay? So the answer to this question is going to be letter B, everybody. I have one question to everyone. If the nurse never had chicken pox and was assigned to someone with herpes zoster, what will the nurse get? What will the nurse get if the person has never had a chicken pox and assigned to someone with shingles? Is the nurse going to get shingles or is the nurse going to get chicken pox? What will the nurse get? If you're exposed and no protection, are you going to have shingles or are you going to have chicken pox? Okay, so the answer to that is what? What do you think? So never assign a nurse who never had a chicken pox, because the answer is that if the nurse is assigned to the patient and the nurse does not have protection, the nurse will get chicken pox. Okay, the nurse will get chicken pox. So that's the reason why we need a titer, everybody. Okay, so again, what is the core principle of, we only have 4 questions for tonight, but if there's one thing I would like to tell you, everyone, it's this. When you go to the NCLEX, the most important thing is you have to study almost everything, the most important concepts, especially the core content, because questions will change. But then if you know from the get-go what is herpes zoster and what are the important things to remember, or the key concepts, then you can still get the right answer. All right? So core content is very important so that you will get the right answer, everyone. Okay? So, and that's what we focus in our review program actually. So before we proceed, so You can visit our website, matusnursingreview.com or matusnursingreviewacademy.com to know our programs, everybody. So we have the 10-day live webinar online class. Our online class starts on October 10. That will be from 8 to 4 p.m. October 10 to December 19. So the deadline for registration is going to be October 3. We also have Tuesday classes, so that would be from 6 to 9:30 p.m. So it's a 12-week fast track NCLEX review, and we do have also the self-study programs that comes with the workbook. Okay, so we have our workbook. Our students, you can order the workbook and then you can enroll online. So you'll be using the workbook to review. All right. So one of the most affordable offers at this time, everybody. So at this time, it's only 143.50. Okay, and you have the whole review package for 1 month. So grab that opportunity before we increase our prices. Okay, and then of course we love our workbook. Yeah, our students really love the workbook. And of course, you know that I do have my book in Amazon. So we're coming up with the next edition next year, probably. So it's a simple, fast, and easy NCLEX review, everyone. Okay, so if you want to review your core content in a simple, fast, and easy way, you can also grab my book. Okay, you can actually also use the book to review online because the contents are almost the same. All right. Okay, so everybody, hopefully you like the book, everyone. Okay, so are you ready for our winner for tonight, everybody? Okay, so learned so much tonight. Very good. Thank you, Timmy Topi. Only for a short time, but hopefully you're learning something. Okay, attend every week and share this with everyone so that they will also know everybody. Okay, so are you ready for the winner for tonight for the free 90-day online NCLEX review? Are you ready, everybody? So we will announce now. So we have Miss Kaur has my book. So what can you say, Miss Kaur? Do you like my book? Okay. So all right. So let's proceed. So the winner for tonight is going to be LaShawn Taylor. So she's the one who won our raffle, everybody. So we put her name on the website and then her name appeared first in the ranking. So congratulations to LaShawn Taylor. Everybody, can you please congratulate her? So LaShawn, you can email us. Please send us an email at info@matusnursingreview.com in order for that, so that we can enroll you in the program, everyone. Okay, and everybody, if you do have any suggestions regarding our Facebook Live, let me know. Okay, let me know. You can send me an email at info@matusnursingreview.com, and then also please give a suggestion on what is going to be the name of our community in this Facebook Live, everyone, and say hi to all of your classmates, everybody. Okay, so again, last message, everybody. The ultimate secret to passing the NCLEX is really mastering your core content in nursing. And in Matus Nursing Review, our goal is to help you master your nursing core content in a simple, fast, and easy approach. Okay? Thank you very much, everybody, and have a good night.